Hello, everybody, and thank you, Corey, for the nice introduction. As you just mentioned, I will introduce Citizen Health to you and why we think it will help us with the challenging landscape of today's knowledge about rare disease. Today, we know about 10,000 different rare diseases impacting over 30 million different patients. And unfortunately, 95% of those currently don't have any treatment. So there's a definitely high need to change that. One of those patients is Amara. Amara is one of the daughters of the co-founders of Citizen Health. And she has a very rare neurological disease leading to 50 seizures a week, frequent hospital stays, needing multiple medical devices, multiple medications a day, and thus 24 hours care. So I hope you believe that Citizen Health approach is very personal. And they had a personal experience that the current healthcare landscape is falling short for rare disease patients. So they wanted to change that. And their idea is to unlock your personal health data, to unlock to empower, to accelerate research and improve care for rare disease patients. Currently, the drug development process takes multiple years, if not multiple decades. It starts with preclinical studies, goes into clinical phases 1, 2, and 3. If we're lucky, the drug development candidates make it, and they go into approval and post-marketing process. And this takes multiple years, if not decades. And with the help of Citizen Health, we hope to really accelerate that and hope to get it up to 15 years max. So how do we do that? Natural history studies are a cornerstone of this rare disease research. What are natural history studies? I guess you've never heard about it, neither did I before I got into that. So natural history studies are purely observational. So meaning we collect data, we make analysis out of it, we see we try to understand how does the disease develops over time and progresses naturally. Based on that, we can characterize the spectrum of the disease manifestation, and we can identify biomarkers and outcome measurements. Why is this important? Well, based on that, we can establish the disease baseline, which is essentially for research and clinical trials. We can make better clinical trials based on that data, and we can help guiding your personal care. So you can probably relate that rare disease patients see any kind of medical care team on a very regular basis. They see multiple doctors, multiple specialists, multiple different hospitals, sometimes in different states. So we see them seeing different providers, and they probably have multiple different records, genetic testing results, scans, imaging, they get multiple medications, and this is all data that we can use and benefit from it. But currently, it's really trapped in our system, and we can take advantage of that. Advantage in which way? Well, you personally can use it to help to guide your own clinical care team. You can, if you give consent to it, you can help research institutions and also pharmaceutical companies to use this data to accelerate research and clinical trials. And you can also help your personal patient advocacy group to see what's the current biggest patient need, and we can help guiding those. So how does that work? And I hope that gave you a good first introduction and overview of what Citizen Health has to offer to you. But just as a reminder again, so it is at no cost for you. You can easily and securely share your data with your clinical care team. If you want, you can give consent and also contribute to research. And if one of your data leads to a clinical or medical breakthrough, the revenue will be shared with you. So that's very exciting and not common. And one of the features, you can chat in real time with your own data and ask questions about your data. A very exciting new feature that's coming soon is the AI advocate, meaning you can not only chat with your own data, but you can also ask questions like, summarize my child's medical history. What are common side effects of the new medication that my child will go on to? Can you compare it to other children in the same age with the same diagnosis? So that's coming soon, and I think that's a great feature to have. So again, it's as easy as signing up. In 5 minutes, you have your account. You just type in your providers that you've been to in the past, and they do the rest. Once all the data is in your account, and that takes a couple of days, but then you have the full access. You can communicate with your data and use all the tools available. And again, you're in control of your medical data. If you don't want to give consent that research can use your data, you don't have to. After the onboarding, again, it takes 30 to 60 days for Citizen Health to contact your providers to put your data into your accounts. It might happen that the provider reaches out to you just to make sure you really want to share your data with Citizen Health. Might happen that Citizen Health reaches out to you and said, can we quickly go over a couple of details? And then again, afterwards, you have access to all these tools. And again, everything that Citizen Health does is in alignment with HIPAA privacy rules. So if you give consent to use your data for research, it's de-identified. Citizen Health is relatively new, so they were founded about 3 years ago. But in that short time, they already published 11 manuscripts. They submitted 25 abstracts for 13 different kinds of medical and research conferences. And they already collaborate with 15 different pharmaceutical companies. And I can share that Team Telomere was selected for the Citizen Health Natural History Study Accelerator program. What does it mean? Well, it means that Team Telomere's community was selected for a program that enables the extraction of the natural history data from 15 patients. And based on that, they're planning to submit a manuscript. So I would like to highlight a couple of benefits based on signing up for Citizen Health. On one side, it helps you as a community in different ways, like helps newly diagnosed patients. It helps patients that already are diagnosed, maybe for multiple years. It helps with your medical management as well with treatment plans. And I will give one example each just to really try to explain how it helps you. So this is one example how this data might look like after extracting it from multiple patients. So you see here on the left side different symptoms, and then down here is the age of all patients. And you see that some symptoms might occur very early on, but they don't last very long and then don't reoccur. While other symptoms might appear a little bit later, but then last very long. So for newly diagnosed patients, that's great to know, just to know what's coming, as well as for patients that are already diagnosed and knew what's coming maybe in 10 years. What do I have to be prepared for? Then this is another example how this data might look like. We're focusing here on treatment patterns, meaning each color is a different kind of treatment. In this example, every patient started on the same treatment and then split up into different treatments. So things we can look at is how we can use this to make a better standardization in treatment decisions. We can also look into which common medication were used in these patients and how long did they use this medication, and how many medication did each patient have. A different kind of representation of data can be something like this. Here we're focusing only on one symptom. In this case, it's seizures per day. And you see the different kind of treatments that patient had. And you can see it started on VNS and the seizures didn't really got better. But then once that patient had VNS, it got much, much better. So meaning this data can help to explore the association between an intervention, the treatment, and the outcome. And newly diagnosed patients can benefit from that. Then additional benefit from sharing your data is obviously for scientists and clinicians. And it can help with discovery, preclinical development, clinical trials, and long-term follow-up. And here I will only give an example for clinical trials because that's the most beneficial for you in current state. So here again, this is an example of a representation of the data. Each line is one patient. Each dot is a seizure event, meaning you have maybe patients that have seizure events lasting 20 years, but you also have patients that only happen in a very early phase. So it's very heterogeneous. And this data we can use to guide clinical trials and to make better criteria for clinical trials, meaning in that situation, we can use patients between 0 and 20 maybe, but not in older age. And with that, I will come to an end. I thank you for listening to me. And I would like to highlight that we just launched Citizen Health last week. And we have a campaign where we try to sign up 100 patients in 100 days. And I hope you will help me with that. If you scan this QR code, it will lead you directly to the website where you can sign up. I will be in the hallway later in the afternoon. If you need help with the sign up, I'm happy to help. If you have questions, come to me. I'm happy to answer if I can. And yeah, with that, I thank you for listening.